Welcome to Facilitate's digital content platform. We're here in Miami, and I'm joined by Martin Andrews, Senior VP for Rare Diseases at GSK. Thank you very much for coming to join us.
Pleasure, Nick.
I wanted to ask, so obviously there's a lot of excitement with GSK's work and their gene therapy coming through. I wanted to ask, what advice would you give to other biotechs or researchers that are looking at their programs and they in gene therapy and they want to achieve quality, robust, and have a good balance between safety and risk benefits at the levels to gain regulatory approval and get their therapy to benefit patients?
Well, I think really the regulators are looking for processes and an approach that will deliver predictable and reproducible outcomes. And I think that's what we should really make sure we focus on. And it's all about getting the basics right. It sounds a bit boring, but that's what it takes. So I think all of the documentation, the validation, the quality management systems, it's really about getting all of the basics in place. And I think one thing that we probably all face is that when we work with academic centers in particular, they're not used to working in that kind of environment. So it's a challenge. The other piece of advice I'd give as well is start with as close to your final formulation as you're possibly going to do. So you don't have to make continual comparability approaches right the way through development.
Can you tell me a bit of the challenges that GSK face in developing an ex vivo therapeutic?
Yeah, you know, there's challenges at all kinds of different levels. I mean, we've been the first ones with Strimvelis, and I think that's been tremendous learning experience because I think we've had to learn together with the regulators, and it's been a very good experience to explore new areas, to figure out new ways of doing things. I think some of the real challenges that we've got going forward are things like bringing the cost down. If we really believe that these therapies could be used more widely in common conditions in particular, out of the kind of ultra-orphan starting point, then clearly we've got to work very hard on semi-automation, then full automation with the processes, bring the cost right down so we can do that. I think the second thing really is in building the specialist infrastructure that's going to be used to deliver these. I mean, the way I see it is with Strimvelis for ADA-SCID, we're very much a supplier to the bone marrow transplant community. So they're already set up with existing bone marrow transplantation for a lot of these diseases. And we have to find ways of being able to help with that facility that they have and make sure we have a brilliant closed loop system so that everything is very tightly controlled and ultimately the patient gets better.
The final question I wanted to ask was, how will the delivery of healthcare change when we've got these complex single-dose medicines being rolled out to benefit patients with rare diseases or indeed in larger patient populations?
I think there are two principal challenges. The first one is scalability. At the moment we're treating very low patient numbers and therefore bespoke single-lot manufacturing is feasible. As we move out to treat, moving from tens of patients to hundreds to thousands of patients, then I think the scalability of that whole system really needs some careful thought. And going into common diseases, you can imagine it's even more complex. Now, that's one challenge. I think the second challenge is that of funding and pricing. Now, this really alters the economics for the payer and for us. For the payer, if something is a one-off therapy, with very long durability, possibly curative, then it means that they have to take a risk if they pay everything up front and they don't receive all the benefits for the duration of the patient's life. Now for the company who's involved, the sponsor if you like, who makes the product, then how do we deal with some kind of amortized payment if that's what the payer wants? Now the danger there is that we have issues with revenue recognition, so when is a sale a sale? And how do you fund all of your business if you're reliant on some kind of discounted annuity stream? So I don't think there's a solution there yet, but what we really need to do is to work together to find one.
It's very interesting. Thank you very much for your time.
My pleasure. Thank you.
Thank you.